Now, people, at least 24 premature babies have died at the Victoria Jubilee Hospital in Kingston since the start of June. The deaths have prompted fears of an outbreak of infection at the maternal hospital. But well-placed sources say that there are currently no reports of an outbreak at the facility. It's understood that the hospital has recorded higher than normal rates of premature births over the period. Some of the babies were also reportedly stillborn. The Chief Medical Officer, Dr. Jacqueline Bisseser Mackenzie, did an interview with Nationwide to give details about the incident.
We have with us now the country's Chief Medical Officer, Dr. Jacqueline Bisseser Mackenzie. Good afternoon, Doctor.
Hi, good afternoon.
How are you?
Uh, well, I don't know if I could say that I'm good because I'm on to speak about such an important matter of this.
Yeah.
I must say that I'm really saddened to hear the reports. It must be a difficult time for the families, and I really want to extend my sympathies and hope that they can get through this difficult period.
What have you been able to confirm from the standpoint of the ministry in terms of what's going on at the hospital?
Okay, well, I must say that we have been having a lot of discussions and dialogue with the region, with the facility over the last couple of days. And first, I want to confirm that the reports do show that we would have had 24 deaths for the month of June, going up to the 24th of June. And to confirm again that we have no evidence of any outbreaks that are happening at this time. I know that persons are fearful when we have outbreaks of infection, but we can say that we don't have any evidence of that. Fact of the matter is that we really have been seeing sicker babies coming in. For June, Victoria Jubilee has seen an increase in the number of babies admitted to the nursery. So these are sick babies that are admitted to the nursery compared to previous months and even compared to the same period last year, where for last year, June, they were seen as having an average of 26 bed occupancy, 26 patients in bed each day, while for this month, they're seeing 36, and they have gone up to 45. So you would see that there's an increase in the number of babies that are being admitted. And in particular, there has been an increase proportionately of the number of critically ill babies. So where for the previous months, when I look at the numbers, we would be seeing probably an average of 35% of the babies admitted being critically ill. For the month of June, and certainly the first part of June, we were seeing upwards of 50% critically ill babies being on the nursery. So it has been challenging. These babies are really vulnerable. What we're seeing is 55% of them are premature, some of them with extreme prematurity, meaning between 25 to 27 weeks. Remember that the term is 40 weeks. And we have been seeing them with low birth weight, about 60% with low birth weight, some of them with extremely low birth weight, which is less than 1,000 grams, which is actually less than a half a pound. So this makes them very, very vulnerable. They have been admitted with varying illnesses, which have added on to their vulnerability, respiratory distress syndrome, most of them presumed sepsis, some with hypoxic ischemic encephalopathy, and some with congenital abnormalities. So these babies are quite vulnerable, and it is a challenge to really support their delicate physiological systems while at the same time administering treatment to manage the specific illnesses. And, it's a critical, very, very critical time for any newborn, but even so for these babies that are particularly vulnerable. And so while when I look at the overall numbers, I think we have been having pretty good success in getting these babies past this difficult period. Some of them do succumb to their illnesses. And this is what we're seeing now with these increased numbers. At the start of this period of time, June, because June, July, August, going into September, October, we start seeing the increase in deliveries at this time and the admission to the nursery. So, the effort that we have to put in place to try to get these babies over this difficult period is really huge. I must say that I think that the response of the Victoria Jubilee team and the team at the region has been really good. The fact that they have been able to prevent any kind of outbreaks with the interventions that they have put in, seeing the increase in numbers, they would have made efforts to increase the separation of the babies in the area and to improve on their infection prevention and control measures, so that we can safely say that we're seeing no evidence of healthcare-acquired infections.
Mm-hmm. And when was the Ministry of Health officially notified of these deaths?
Well, the region would have, the deaths started to increase in the first 2 weeks of June, and the regions became aware of it through their routine inspections, and so they would have put their interventions in place and would have acted, I believe, with providing good guidance to the facility. Certainly there would have been no evidence of an outbreak, and so while it is that persons within the ministry would have been also providing support, because as we started it, I would say from May, we would have started to increase our overall supervision and oversight of the different areas, having had several meetings. I mean, today and yesterday they would have had training sessions, because we know that we are in this period. There has been increased oversight. So the region would have recognized and acted promptly. In terms of an official report to the ministry, I cannot say that it would have been necessary at the time when they first noticed it, but certainly as the numbers would have increased, they would have advised us.
And just to be clear, Dr. Bisesa McKenzie, what has been the percentage increase in these deaths when compared to, for example, May or the other months?
I think let me just quickly bring up those numbers so that I'm telling you the...
And as you do that, Dr. Bisesa McKenzie, also compared to last year at the same time, as you have indicated that once you're touching this period, you are seeing a spike.
Right. So certainly there's a definitely increased compared to the earlier months, January to May, because when we look at the rate, the neonatal death rate, from January to May, we would have seen about a 14.8 per thousand, which we compare per thousand live births. Mm-hmm. So it would have been 14.8. And when you look at these numbers now, it is over 70 per thousand. So there's no doubt that this is an unusual situation, which is brought about by this increase in the number of critically ill babies coming into the nursery.
So that's that very significant spike, Doc. So I know you say there's been an increase in the numbers of critically ill babies, but has any investigation been done to ascertain why that might be happening compared to the previous 5 months?
As I said, we have been having discussions all week on this, and we have looked at preliminarily. I can't say that we have finished our investigations, and so this is why I'm able to tell you what are some of the illnesses that these babies have, and how many of them are premature, how many of them with low birth weight, because we have been looking at the cases to see if there's any kind of commonality, any kind of common thread, if there's any signs of any healthcare-acquired infections, etc., which we know in the past have been the reasons why our numbers spike. So yes, we have been investigating, looking at each case individually. We've looked at the culture reports. Most of the babies, about 80% of the babies would have been cultured. Very few of them would have come back with any positive reports.
And when you say they have been cultured, what does that mean?
So the babies are screened for infection. So usually, so some of them would have come in, and based on the conditions surrounding delivery or what we see at delivery. There may be the distress that the baby is in and the other symptoms. There may be a presumption of sepsis, and so the babies would have been screened. There are other babies that just because of the illnesses that they have and because of their vulnerability, they would have been screened to see if there are any infections that are there.
Right. Go ahead, Sanjay.
And what assurances, in a sense, can you give to expecting mothers now across Jamaica tonight that public maternity hospitals remain safe for delivery and postnatal care?
I think, I would really want to reassure persons and say, yes, we do offer good care, excellent care in our institutions. The fact is that there are various factors that will contribute to the babies being born critically ill. When you look at nurseries and high dependency areas, it is the babies who are sick, the very sick babies that are admitted to these areas. And so, therefore, the effort that has to be put in order to increase our survival of these babies is tremendous. So what we really want to do is to prevent the babies from being born with these kind of conditions. And the ministry has been increasing its effort in these areas, certainly in terms of our messages, media campaign that we have presently on about improving antenatal care, getting our mothers to come in so we can detect any problems, because of course our mothers with chronic diseases, diabetes, hypertension,
Right.
etc.
And if you could forgive me, Doc, for interrupting, because that's something else I wanted to ask, whether the preliminary investigations had shown you any kind of similarities or commonalities between these mothers or among the mothers who have who are the mothers of these babies that could perhaps explain the spike.
Right. So we are still looking at all the factors. I must say that we haven't done all the investigations as yet in terms of the moms, but what we do know is that 50% of the mothers were below 24, with 25% of them being less than 20. We know that the very young persons are more vulnerable, especially in the first pregnancies. And we would have 12.5% of our mothers that were over the 35 years, where we would consider them to be at an advanced maternal age. And then, of course, we had some of those that were very advanced. So that is just one area that we have looked at so far. We are doing the further investigation to look at the other factors that there may be, because certainly it's where it is that we need to intervene. I can't really overemphasize the importance of adequate antenatal care, so that we can get our mothers who are, likely to run into problems discovered early, so that we can have early intervention. And we are working over the last year, last 2 years. Certainly we have been working on training, improved training in terms of our doctors, our healthcare workers, in terms of caring for the mothers, caring for the delivery process, etc., to ensure that we have good outcomes. And we have now started to improve in terms of the training of our doctors, other healthcare workers in terms of neonatal care. We've done a lot of work over the last couple of years in terms of improving the capacity within the nurseries. But, any system can become overwhelmed when it is that there is a huge increase in the numbers. We face shortages of healthcare providers, especially our nurses, and this can add to the overwhelming of the system. But we are working. The region has put in several measures at Victoria Jubilee in response to the increasing numbers. to have staff move from other hospitals to try to support the nursery because, as I said, we're at the beginning of the season and we really want to ensure that we try to reduce the possibility, of any more deaths and certainly to just really increase the chance of survival of these children.
Final one, Doc, before we let you go. You would know how sensitive this matter is. The so-called dead baby scandal from a few years back. A lot of people still remember that. Following up on Sanjay's earlier question, can you assure the Jamaican people that so far all you have seen indicates that proper protocols were being followed at the Victoria Jubilee Hospital and none of this can be attributed to carelessness or negligence?
Well, we continue to investigate, but yes, so far from what we have seen, I'm really proud of the effort that the team has put in. It really is a tremendous effort, to come out from this investigation and realize that there was no infections here, no acquired infections, because it means that they would have made tremendous effort in terms of enhancing their infection prevention and control measures. So I am reassured by the effort that is being put in. We from the ministry will continue to support the team. We will actually go out to the different areas and to just do provide some oversight in those areas, and we're also going to help the regional team in terms of the fuller and more complete investigation of these cases so that we can identify some of those risk factors so that we can ensure that the prevention starts from very early.
Dr. Bisesa McKenzie, thank you so much for your time as always. I appreciate it.